Namaste, Anita, and namaste, all the dear friends from around the world. Nice to see you, Anita. You're looking so good. How are you today?
I'm doing well, thank you.
Yeah?
Yeah.
Must be pretty early in the morning for you.
7:30.
Good, good. So we are very happy to have you so early in the morning, and you are very, very well prepared. And folks, if you are all online already, and if you are able to see us and hear us, please let us know if everything is working, because then we are actually able to confirm that everything is perfect technically. So please let us know by your comments or some statements. We will be very, very happy to hear from you. So we are here with one of the most wonderful ladies I've known, Anita Claney from Tucson, Arizona, which is also a very, very wonderful place in the world. It's got desert, it's got mountains, it's got so many fascinating things, and so many healers and shamans, and everybody likes to go there. So Anita, you are really living in such a fantastic place, huh?
Yes, thank you.
Great, great, wonderful. So Anita, can you tell us a little bit about yourself, or do you want me to say a few words? Actually, I will say a few words. Anita is one of our very, very long time Viniyoga therapists. She actually was part of the very, very first batch of yoga therapy training that I did together with my father way back in 2007. We did it from 2007 till 2010, I think, and it was probably the only batch where my father taught us while in the United States. And it was a North American batch that we did, and Anita was part of that. And Anita graduated from that very, very well, and she has been offering yoga therapy to an amazing amount of people in Arizona, including lots of war veterans through a very special project that she did in the hospital, which we will talk about a bit later. And Anita still continues to study till this day with my mother, and is now learning a lot of chanting, which is also very fascinating. So, Anita is also a guest lecturer at many yoga therapy trainings that happen in the US, where she's invited to talk. And she's actually a wonderful, wonderful therapist with lots and lots of experience. But more importantly, a wonderful person, with a very good heart. And actually, Anita, it's a long time we know each other, huh? Because we met in 2003 first, like you just said before we started this, and that's 18 years ago. And I think my daughter wasn't born at that time, or she probably was just born, and your children were still teenagers, and now you're a grandmother. So right. Time is flying very fast.
It is going too fast sometimes.
It's so fast. So Anita, please tell us a little bit about your history into Viniyoga, how it started, and how you sustain it.
Sure. Thank you, Kausthub, for such a wonderful introduction. I came to yoga in the 90s. I was in psychotherapy, psychodynamic therapy, and I was also having a lot of physical chronic health issues. And my therapist suggested that I try yoga. So I went into yoga, and I was very fortunate in that I was too ill to go to a yoga studio. So I started with a private teacher. So I always had a private practice. And I studied with other teachers, went to Kripalu, and then you came in October of 2003, and my teacher said, well, there's this man it's just for you. And I was a complicated individual between, I had anxiety and depression, autoimmune diseases, so complicated case. And she said, why don't you go? I'm not going to be in town, but you go to the workshop. So I met you, Kausthub, and I mean, immediately felt a connection to you and to the tradition and the teachings. And they just were, for me, it was, oh, this is what I've been looking for. And then that January, I went to India, and you and your father were teaching a small group, right? It was a small group of us that came. And you and your father and some of the other teachers were teaching us. And I met your mother that way, and then started with her. And she gave me a practice. And at the time I thought, because, you know, I was doing shoulder stands and headstands, and she gave me this very simple practice with breathing. And I was just, wow, this is like baby yoga. That's what I thought it was. And I had faith in your mother. I had this shraddha. And so I said, okay, I'm going to go home. And I was between jobs, and I thought every day I got up and I practiced and I did it. And within 6 months, you know, I was off of most of my medications, and my anxiety was way down. So this yoga that was designed specifically for my system, my constitution, was life-changing. And because of that, people saw, oh, you're so different now. What are you doing? And so people started just asking me to teach. And I said, no, I'm not a yoga teacher. And then I began really intensive studies with your family. So.
And what sustained you? Because what is unique to the Viniyoga tradition that you don't find in other traditions, especially in the US now?
What sustained me? Well, I think the support structure, my relationship with you and your mother, who I consider my teacher, Anita Desikachar, and all of the tools that I was able to learn. The teachings, you know, I thought finally I found a place where the teachings go very deep, as opposed to a mile wide and an inch deep. I'd finally found somewhere where I could study a mile deep and always study.
That's very interesting. That's very interesting that you said that. And let me talk a little bit about what you just mentioned a few moments ago. You said something about the support system. Can you share a bit more about it? Because I'm not so sure that most people in the audience may understand what you mean by that.
Well, having a teacher and somebody that I can be with who's reflecting back to me my really best qualities in a way, and supports me in that and believes in me, and feeling that transmission from the teacher in a very positive way, and who is there for me unconditionally. Doesn't mean it's not difficult and sometimes challenging, and that we know that this is the way towards personal and spiritual transformation. And so, you know, I chant with your mom on Skype, even though I can't travel to India now. So
yeah, and that's very interesting. What drew you to chanting? Because I remember in the beginning you were not so curious about chanting. You were not so interested or fascinated about it, but now you're
no, I have
so much.
The transformative aspect of it. I'm a monotone, and I have absolutely no musical ability. So that's why I didn't chant in the beginning, because I get so nervous. However, I do very complex chants with your mom now. And it is I think it's been the most transformative tool for me in terms of the amount of focus and the confidence it's given me in myself. And just that I can actually feel now when I chant, I can feel kind of the endorphins just flood my system. I was chanting this morning for about 40 minutes before, and, you know, maybe 30 minutes into it. And again, it's not an ego expectation. I'm focusing on the chant, and chanting is very challenging for me. And then all of a sudden I just start to feel good. How else can I say it?
That's good enough, as long as you, and it's very interesting that you said that you feel that the endorphins are flowing when you are chanting. That's the first time I've heard somebody say that, but I can understand.
Yeah, well, you know, my youngest daughter is getting a doctorate in psychology, and she had a guest lecturer come, and he was a psychiatrist, and he was starting a research project on chanting and the serotonin levels. And the hypothesis being that chanting increases the production of serotonin in the system. And he was doing the study on the monks in Dharmasala chanting, the Buddhist chanting.
Okay.
So
I guess
there
it
are
could work for the Vedic chanting as well.
yeah. Well, it's focus, it's vibration,
Exactly.
it's bhavana, you know, all of these. Yeah.
Uh, Now, slowly, I want to come to the work that you do. Can you share with us uh, the work you are doing there in Tucson, and so that people can know what you're doing? Because I feel
Sure.
it's very fascinating what you're doing.
Sure. Well, in 2009, I started working. First, it was as a volunteer, and then over the progress, I think about 8 years. Um, for a year, I volunteered and in the inpatient PTSD unit. And so it was in the hospital, and we would have a small cohort of veterans who would come and live in the hospital in the psychiatric unit for 30 days. And I had a fabulous boss. He was a clinical psychologist, and his associate, she was, I think, a psychiatric social worker. And so I would offer 3 times a week, come into the group and do yoga therapy. And so I had them for a month. So it was perfect for the Viniyoga approach, because I was allowed to, you know, build up progressively over the month, and about 10 to 12 sessions with them in a small group. And then I would encourage daily practice. That at the same time that I did that, I started a private practice. So what happened was the VA changed their system, and my boss left, and they went to more of a sport yoga approach, as opposed to this really transformative. The breathing is what the vets always commented on. The breathing was really powerful influence on them. In fact, when my boss, Dr. Heineke, when he moved to Florida, he actually sent me an email and said, can you send me some of the breathing exercises, which I did. So, and then now, so that ended because of, I think, politics at the VA. And then now my private practice. So it has been full-time and busy. At 65, being a grandmother and 3 daughters, I'm trying to be more part-time, but you know, last week I saw 18 people. So and now it's everything. I see everything. It's so fascinating. I have great students. Some come every week, some come once a month, some come every 2 weeks. And I see cancer, developmental trauma, orthopedic issues. So it's a very wide-ranging practice, which I think the Viniyoga training I have no hesitancy or say fears or lack of competency or confidence in being able to work with anybody who walks through my door.
That's excellent. And can you say a little bit more about how that is supporting you? Like, how is Viniyoga supporting the work you do? Like, in what ways?
My training. I mean, all of the training that I've had in terms of the different models that we work from. And I would say, you know, the Panchamaya model, because we're not, everybody has a different practice. Everybody has a different interest that comes to see me. And I've learned to be able to sit with them and meet them where they're at and design the practice according to what their needs are in the moment. And to really include them so that we're a team. And I say, you're going to become your own teacher. I'm giving you the tools here and the guides. You are going into your body and your mind. And I think the most important thing about this, that I have many people who come to me. I would say 90% of my students don't do yoga, don't know what yoga is, are not really particularly interested in yoga. They just want to feel better. However, and they come for a specific, you know, thing. So, you know, oh, my hip flexor, or I have sciatica. or I have anxiety because I have ovarian cancer. So many different things. However, as going with, like, for example, the Panchamaya model, so I'm addressing things on a deeper level while I'm helping them with the Annamaya. And then they do begin to notice it spontaneously. So I don't tell them this is what's happening. I say, you know, yoga has this capacity.
And that's very, very wonderful. And that, do you teach all these people the same kind of practices, or even if within the same kind of practices like asanas, do you teach them the same set of asanas, or do you teach them differently? How does it work?
Everybody has a different practice, because I learned from you that in the case of, you know, someone comes in with sciatica, take that for example. However, they may have depression or they may have anxiety. That's going to look different. The practice, the breathing will look different. The bhavana might look, it's different. So it's the whole system, right, that we're looking at. And so everybody has a different practice. That's why I love this, because it's not boring. It's very creative. And then oftentimes too, you know, a student comes to me and says, well, I have this from physical therapy. I really like it. And so I say, okay, let's see how we can adapt this, modify it. Let's put it in your practice. I'm very open to what people are doing. And then, you know, yesterday I have this lovely student, and she has had 2 spinal fusions. She's in her 70s. And so she's struggling with PT, and it's hard for her because they're giving her exercises that she can't really do and cause pain. So I said, okay, let's work together. Let's see, you know, what's your body doing here? And she comes from this Western mindset of, you know, no pain, no gain. And so slowly, and I've been seeing her now for many, many months. And yesterday she was like, oh, I get what you're saying. She goes, I'm pushing too hard.
Yeah.
And I said, yes. And so it's like, be gentle. Viniyoga, people sometimes, you know, are disparaging about that. We're too gentle. And I'm like, I try to explain to them, this is where true transformation can really happen.
It's true. It's true. And how do these people come to you? Like, do you advertise, or does it come from word of mouth, or how do they come? What kind of people come? Like, what kind of age range? What kind of ethnicity? What kind of jobs? What stage of life people are in? Can you share a little bit more?
Yes, I mean, in the very beginning, no, I've never advertised or marketed myself. I was very interested in Western psychology, and how, you know, kind of the parallels between Western psychology and the philosophy of yoga and the sutras. So I had been in that, and I have no medical degree or training or any psychological training at all. So I was asked to join I was invited to join a case study group where therapists would meet weekly and discuss cases, and it's confidential. And I learned a lot about that from the Western perspective. And they would refer people to me, basically word of mouth. As I said, people are coming to feel better. So if they feel better, they'll refer you out. I didn't have the time or the energy to really market myself. So, and I also had the foresight to build it. Now, in terms of who comes to me, it's really varied, because I used to be by the university. I used to have an office there. So I saw at that period of time younger people, not in their 20s, but younger. And then I moved, and again, to more in the center part of town. And then I moved up here. Now I would say, in terms of the majority of my practice, would be people in their 40s up to about 80. I think 80 is my oldest student. I find that they are at a phase in life where they have more focus and time to do a daily practice. Younger people are interested and like it. Their lives are so busy, often it's hard for them to have the daily practice. However, many of my students don't practice daily. And, you know, I'm patient with that. you know, I have someone now 7 years, she's just started daily.
That's amazing.
Yeah. Yeah.
So in your view, what is it that makes the transformation work? Is it the technology, like the tools and the practices, or is it the connection that they share with the therapist, or is it some other mystical force, the force of divine? What is it? What is it that, in your view, is making the transformation work?
I think that my competency in knowing how to design a practice and work with them. So yes, the relationship is really important. The relationship is really important in the sense that I've continued to do my own personal work. So I continued with my therapy and my support and my training from the tradition, and have always thought that that was really important. And then the study with your mom and you to really continue to deepen my practice and my tools so that my practice is informing, and the benefits of my practice is informing what I can do with students, my capacities. Is that making sense?
Yeah, of course. It's perfect. It's one of the things that I often tell my trainees, that the two cardinal rules in the yoga therapy. The first rule is you can only heal somebody at the level of their empowerment. And the second rule is you can only heal somebody at your level of empowerment as well. So only if you work on yourself deeper and deeper can you help somebody else deeper and deeper. Whereas if you want to stay on the surface at a very shallow level, you really cannot help somebody at a much more profound level. And in this context, I really would like to ask you a question, because there are many approaches now taken by, let's say, the modern yoga therapy approaches, where they refer to like research studies done by some random person here or there, which says, oh, for this back pain, you do this set of asanas, there was 50% success, so it's recommended. Or if you have headache, you do this kind of pranayama, you had 60% success, and therefore you take this technique. Whereas the way we work is so much different. And in your view, what works better?
It's very hard to imagine how a prescriptive, because I think what you're describing is a prescriptive approach. So, and I think it's very complicated in the US because, and I'm speaking to the US, but if people are trying to work within the medical system, or, you know, I know many good physical therapists, however, they're constrained by time and insurance. And so, you know, they're seeing someone every 10 minutes, getting them working alone. Like this student who came yesterday, she went to physical therapy this week, and she said nobody watched her. And she's 70 something with 2 fusions. And she's given a handout. Do this, do this, do that. And again, I'm not criticizing the physical therapist. This is the system and the way it's been set up. So I feel like I have so much luxury to sit with someone. My sessions are an hour, watch their body, watch their breathing, listen to their conversation, everything, and then be able to kind of get this. Now it's almost intuitive, because I've spent so many years, like I would go back to my notes. Before I saw a student, I would design a practice. I would read what I had learned. I would really, really do that. And now there's more of a flow because I have more experience, where I can just kind of go, oh, I think this set of sequences, and let's do this kind of breathing, and maybe you'll use some sound will work. But that didn't come naturally. That was a lot of hard work and study, you know?
Absolutely. I also remember for some years we were meeting regularly, where you would fax your email the practices that you were going to give, and we would discuss about the students and then refine those practices. Yeah, of course.
Yeah.
So,
Exactly. And, you know, when you think about the way that the way that psychotherapists work, they stay in supervision groups. They stay connected to somebody, and they learn about, you know, when is this relationship, like there have been times for me when, I don't know if the audience is familiar with the terms of transference or countertransference, but, you know, we're sitting with somebody and they're transferring onto them, onto us unconsciously, their own unmet psychological needs or their own deep vasanas. And then if we can't sit there, this is what you referred to before, if we can't sit there and recognize that, then we're likely to be reactive back to them. And that's happened to me. And I've made those mistakes, and I've had to look at myself and kind of go inward and see, okay, this is what happened. So, yes.
And I think this is where I would like to ask you if you would be very willing to share some of your very challenging stories that you had dealing with your clients. I know you have some very tough experiences, and I think those would be very helpful if you could share one or two to the audience today.
Well, I think it was really hard for me to work with the veterans. And the veterans, it was, how do I say this? Demographically, you know, many of the veterans in the armed services are coming from a lower socioeconomic group of people. And so I come in, I'm this white woman and privileged. And so how to build a relationship there and have trust is not so easy. And how for me to understand them is not so easy, and for them to understand me. And I was very nervous when I started. I'll never forget at the end of 1 month, it's one vet looked at me and he goes, that first night, he said, I sat there and looked at you and I said, how is a woman with this much anxiety going to teach me how to calm down? And he goes, you did. Because I was so nervous. And of course they pick it up. They're very sensitive. I mean, when you have post-traumatic stress disorder, you're hypervigilant. So you really are, you know, able to do that. So anger, a lot of anger. You know, I worked in a room with a panic button. And so, but I learned to help them take responsibility for themselves in small ways. And some of them didn't want to be there. They would be, you know, I hate this, excuse my language, please, but they would say, they would yell at me, I hate this fucking shit, you know? And I said, well, you know, please go talk to Dr. Heineke. He wants you here, you know? If you want, you can just sit here, you know? It's fine with me. So becoming much more matter of fact with them. And what was really amazing though, was I had the privilege of teaching, you know, Mexican Americans, Native Americans, you know, people from small towns across the Southwest. And all of them like took to the breathing for the most part, most of them, you know, they really liked the breathing. We were what's called a polytrauma unit. So it wasn't only PTSD, but it was war wounds also. So mostly chair yoga and you know, relaxation also at the end. So, but one time one man was screaming and yelling and he was cursing and I was like, oh, I'm going to have to hit the panic button. And then I just turned to him and I said his name, let's say Tom, what can you do right now to help yourself? And he just looked at me and he sat down and he started breathing. And another man, you know, had a visualization of like water putting on his face. So he got up and ran over to the sink and put water on his face. So again, little things. I mean, you know, I'll never forget the man who, he didn't like this, he didn't like it, he complained. And then we talked about very simple Bhavana visualization, kind of an introduction to meditation, the way we do with gestures and Anganyasa. So I was discussing the object and we went around the room and I said, if you don't mind sharing with me, what did you pick? And he said, my Harley. I want to meditate on my Harley motorcycle. And I said, oh, really? Do you mind explaining why? And he said, because the only time in my whole life I ever feel peace is on my Harley.
That's so funny. That's so great.
So I said, sure, meditate on your Harley, And another one.
I'm usually telling students, oh, meditate on the sun, meditate on the moon, meditate on the ocean. I have to include the Harley Davidson next time.
Yeah. And another one, I'm 65, but another one, it was his wood shop, right? And I said, well, what's in your wood shop? And he said, well, a Bade portrait of Bo Derek. I don't know if you remember her. She was like that. Right. And I said, well, I don't know about that. And he goes, no, it's my woodworking equipment. And again, this is where I feel peace, because I had been talking about the idea of, there were a lot of anger issues, right? With PTSD in men, there's often a lot of anger that we're working with. So I'll never forget one time the Dr. Heineke called me up. And again, this is where I wasn't contained enough. I had come back from the funeral of my favorite brother-in-law. And I was driving to the hospital and my head was like, I should not be teaching tonight. But I couldn't get a hold of the psychiatric nurse to just say, please cancel. So I went ahead, and it was the first night with a new group and I was off. I was just off. I wasn't fully present. So Dr. Heineke calls me the next day and he goes, they don't like you. And I mean, that triggered all of my own shame issues and my confidence in my self-worth. And he goes, look, Anita, I know, he had a lot of faith in me. I had to go and practice and, ask in my intentions for like, where was this shame coming from? Because part of my logical mind knew that, I was off that night and, I could work towards, repairing that, right? That there had been a rupture. So then I go the next class and I'm teaching and everything. And there's a huge backboard in the back of me, right? And so there comes to a part where I ask them to close their eyes and do breathing. And I just happen to turn around and look at the blackboard. And so the doctor has used me as the way to work out all their stuff. So it's like, Anita did this, Anita did that. It was the whole list of things, and I had to, it was not fun to look at, what their opinions were of you, So when the eyes came to, I just stopped him and we had a conversation about what was on the blackboard, and it was good, but not easy. I had to have enough of a hamkara, had to be strong enough to be able to stay present for that.
Yes.
Is that kind of what you're looking for?
Yeah, these are very interesting, because the next question I wanted to ask you relating on to this is, because today this concept called yoga therapy is such a buzzword and everybody wants to become a damn yoga therapist, because this is the new cool thing, because they finished being their yogacharya certificates. Now they want the yoga therapy certificates. Do you really think that everybody can be a yoga therapist, really?
No, not everybody can be a family counselor or, again, it requires, as you said earlier, we have to look at ourselves and we have to do our own practice, and we have to, allow the vasanas, examine the samskaras, allow the vasanas to come up, which is terrifying. It's not easy. So I have a lot of compassion and empathy. I have many students who, it's like, if the practice is too intense or like, nadi shodhana, too much, so we don't go there. That's not a prescription, nadi shodhana. Many people, it's very agitating.
But I'll tell you, there are so many papers churned out by people on nadi shodhana pranayama for almost any and all of the diseases on this planet Earth, and it's a catastrophe.
And do you know something? Out of all of my students, maybe 10% of them have the capacity to do nadi shodhana in a way that's beneficial for their whole system. The others, no. It just aggravates, it's contraindicated, and it's quite remarkable. There's no appreciation of the amount of stiram and sukham that's necessary to be able to do nadi shodhana in a way that has efficacy.
Exactly. And people think that nadi shodhana is a toy, because some bloody people have put it on a research paper. So everybody is like, okay, I do Nadi Shodhana, I do Nadi Shodhana. And they don't
Yeah.
even know what they are doing. They're just
No.
somehow
Yeah.
fiddling with their nose and thinking
Yeah.
they are doing Nadi Shodhana.
No, I would say it's at least like in a year I'm working with people or more before I would even try the Nadi Shodhana. Some of them, yes, I can, but no, you know, it's.
There's also this movement in the US, I think, a lot where many of the yoga people and yoga therapy, so-called people, trying to legitimize themselves or their approaches by just associating them with the medical doctor or a medical profession who have no clue about anything which is happening in the human body except at a physiological level. And yoga is not just about a physical approach. So
Right.
what is your view about this? Because it's happening a lot in the US especially, but also some people in India also, just because they have a medical degree tagged along, they think that they are the experts of yoga.
Oh, it's really common. I mean, I'm seeing it now in my students who come to me and they've had an evaluation and they'll tell me that, you know, the spine is 5 degrees here and the hip flexor is this, and then the adductors are weak. And I'll say to them, you know, I'm not a physiotherapist. And the way that I work is if we're breathing and breath is taking us into the asana and we do our practice, things will transform. And I tell them the story that before I got a practice from your mother, I used to go to the chiropractor every other week and get these adjustments and everything. And I was doing this very basic practice from your mom with, you know, maybe inhale 4, exhale 8, and very simple asanas. And it was about 4 or 5 months in, and I realized I haven't called the chiropractor. I've never been to a chiropractor since then.
Oh, that's great.
And I've told my students, I said, if you're breathing and the breath is taking you into this, and we have Sthira and Sukham, I said, your body will make the adjustments in a very, you know, it doesn't, and I'm not negating physical therapy. I'm not. This is a very different approach. So, and there are differences, and there's areas where physical therapy is very helpful. But when I'm talking about, I'm not talking about like knee rehab after a knee replacement or something like that. I'm talking about where, you know, the body is just tense in all different places and pulling, and that is sent it out of adjustment. So if we can relax it, right, and then begin to strengthen it, good things happen. And then I think, again, the benefits are in the manomaya, the vijnana maya. And again, the medical area, I think this is what you're talking about, does not address the manomaya or the vijnana maya.
Yeah.
Even the pranamaya it doesn't address,
Yeah.
you know. So, and like even when someone comes to me with a PT exercise, I say, why don't we use the whole body to do this? Let's use the breath to do this, you know. So
yeah, that's very good, Anita. Thank you. Now, I have a very interesting question. Normally, when we are working with our patients, because empathy is very important for yoga therapy, and when we are empathetic to other people, it's quite often that we will have some kind of energetic transference, and we sometimes pick up the heaviness or the energy of our patients and things like that. Has this happened to you, firstly? I know the answer. The first part, has it happened to you? Second part is, how do you recover from that? How do you
it's
manage?
hard.
Yes, because
Yeah.
this is one of the things that is important, because it's why I say not everybody can be a yoga therapist, because many people don't want to pick this kind of stuff, but it is not in their control, and they will pick it up, and they will, if they don't deal with it, and whether they recognize it or not, it's going to affect them. So how do you deal with it?
I do deal with it, because when I first started at the VA, I would be crying all the way home in my car. Crying all the way home. I would wake up in the middle of the night and be, okay, oh, what do I do with this person? You know, how do I, what, you know? So how do I deal with it? I take really good care of myself. I exercise, I do my practice. I have my relationship with my teacher, with you. And I had to go back to therapy. I went back to therapy because I had developmental trauma, and I had to go back and work on my internal boundaries, not just my external boundaries. So I went back to therapy to work on that so that I could be present with somebody and allow for the empathy to be there and not completely internalize it all. So we think of more like maybe semi-porous boundaries.
Yeah.
And that way there's more that I could contain. So now it's very interesting because my practice has progressed. I would say in the last, I started taking the advanced Vedic chant training with your mom in India. When did that start? 2 years ago?
Yeah, before the
2 years ago. Yeah, and so finally I really added a tremendous amount of chanting to my daily practice. And all of a sudden, like within a year of that, I noticed that people were saying to me, can I come every week? And, I'm very careful about what my scope of practice is. I'm not a psychotherapist. I'm not even a counselor. However, I was able to move into this place where I was doing enough of my own work that I could sit with someone and really hold the space and let them talk for 30 minutes without probing or giving advice or even asking, how does that make you feel? Occasionally I might say that, and just be, and then sometimes I would relate it to the Yoga Sutras, say, oh, in yoga philosophy, and having that reflective listening and empathic listening. And then we get to the yoga practice. This has happened as a progression.
Yeah. And so even though you say you are not a psychotherapist or a counselor, in fact, you are playing that role, whether you like it or not. And this is the beauty of.
Yeah, well, and some of, no, it is the beauty. And some of the goals here I have are to prepare people for therapy. So if I see, a certain level of trauma, and again, there's fear, there's mistrust, people have been wounded. And so if I can be the relationship that is positive and they can feel that there's possibilities and they begin to see their own potentials reflected back to them, then when I say, if I refer to therapy, then it's much more likely to happen. So sometimes my goal with somebody is to help prepare them for some therapy. Also, there are instances where I will immediately in the first session say, it hasn't happened for a while, but where I'll say, I would enjoy working with you. And when I'm working with this trauma, you have to be in therapy at the same time.
This is very, very important because this is also what I tell some of my private clients. I say to them that we can work together as long as you're continuing to go to your psychotherapist.
Right. And I will ask people, I would say, are you in therapy right now? And they'll say yes. And I'll say, how often are you going? And they'll tell me, and I'll say, it's very important that you do that. But then when I get people who are like not at all in therapy and I sense the level of challenges that they have, then I make that a requirement. In fact, I mean, this is a very serious topic and it's good we discuss this. I had a student who'd been coming to me for a while with what we call refractory depression. It's intractable depression, and tried everything. And I began to be concerned and actually had to do kind of a very termination with her, very slow, and saying, this is important. I found a psychotherapist for her. And I said, while you're in therapy, I won't be able to see you, but I will be here for you. Give me a call, So I wanted to maintain the connection. I said, call, we'll chat for a few minutes. And so she did, she called. And it was only maybe 2 or 3 months after I'd set that boundary that she had a very serious suicide attempt and was in the hospital for weeks. And I was, and she's okay now. She moved out of state and she's moving back. She called me last week and said, can I come back? I'm much better. Can I come back to yoga therapy? And I said, yeah, let's meet. Let's talk about it. I didn't say yes. But I felt so grateful that I had recognized that and gotten her into therapy. And it set the boundary that I wasn't going to be able to see her during that time. And I had no idea that she would try to commit suicide. That I didn't know, you know, I just, you know.
And I think this is a very, very important point that you raise, because most people who are coming to yoga now, or especially yoga therapy or things like that, even though they come with, let's say, a physical problem like back pain or neck pain or things like that, they are also coming with their other dimensions like psycho-emotional dimensions as well. And just like body has muscle memory and things like that, even people who are just doing some asanas can get triggered at an emotional level, at a psychological level, at a spiritual level. And this is what many, many, many yoga teachers and many, many yoga therapists also don't recognize, the damage that they can do just by casually teaching them whatever the asana they think they can do, or just focusing on the body and not really paying attention to the more subtle and more sophisticated layers of human existence. And I think this is a great irresponsibility. And I think many, many yoga associations are also failing to not focus on that, because most of them just focus on the physical dimension. And it's very, very important, because even if a person will come with just back pain to you as a therapist or me as a therapist, they are bringing together their other hidden dimensions as well, which we have to take into consideration, even if they are not talking about it or discussing about it, because their body will show signs of these hidden traumas as well. And I think that is the big danger now of just all this standardized approach, prescriptive approach, that we can do more damage through those kind of superficial and at the surface level of teaching, rather than if we fail to, rather than when we are able to focus on more subtle levels and be more gentle and more careful with practices. Because just because somebody doesn't talk about their trauma, it doesn't mean that that's the elephant waiting in the room.
It's always the elephant in the room. And I say to other, you know, I mentor some yoga therapists, and I always say to them, be looking for, I said, look, if somebody has a back pain and it becomes chronic and the physical therapist hasn't been able to help it, or the chiropractor or the pain doctor, then there's something going on these more subtle layers. And so I look at almost anybody that walks in the room, I say, this is going on. Now, they may never tell me, right?
Yeah.
But I can watch them, and how I can really see it is that very difficult for them to get into their body, right? And what I mean is, like, to do the practice with the breath and using the breath, what they'll do is they'll stop, they'll talk to me, right? They'll say, well, I like this better or that, you know, and these are defenses, and it's okay. I'm not giving a judgment or a criticism of that. I'm realizing that it's terrifying. And so we have to recognize that and be able to, you know, I have students that I let them design their own practice, because that's where they're at with their trauma, and that is going to help them feel safe. And, you know, and when I say design their own practice, it's like, well, I want to do this, I want to do that. And of course, my goal is working them towards, you know, a practice that I can hopefully give them that feels safe for them and allows them to move into their body. But in the early years, I made so many mistakes, because I would be like, here, do this practice. And finally, this one woman came to me and she goes, you know, you're asking me to do this. She goes, this opens my heart. I can't do that.
Yeah.
So exactly. And I think experience teaches that to us. Training, good mentorship allows us to see that. And it's very common. It's really, really common to see that.
It's very important that we talk about this, because in my experience, and please let me know what you feel. In my experience, 95% of the people who come to yoga therapy, even if they're coming for a physiological problem, the source is always somewhere in the psycho-spiritual dimension, because they are not coming to yoga therapy as their first line of defense. They have tried medical doctor, they've tried acupuncture, they've tried physiotherapy, they've tried this, they've tried that. It doesn't work, which means the problem is obviously not at the physical level, dummy. It's something deeper, which people in the yoga therapy fail to realize, and they're just following blindly the medical approach of let's do physical, which is such a stupid thing. And that's why I strongly feel that medical people should not be involved in yoga at all, because they corrupt yoga and corrupt yoga therapy because they tend to focus too much on the physical. They don't really get the whole other dimensions as well. And that is the problem. And I think that's why I always remind people that 95% of people's physical problems also have psycho-spiritual causes. And I think this is very, very important.
I would agree with you completely. And I think for us to hold that and understand that really then informs the approach that we take with them. Very different approach when we understand that, you know, I had this one student, he came to me, he'd grown up, he was Mexican-American, had grown up in a mining family, poverty, obviously lots of early childhood trauma. He had back pain and he just wanted the back pain treated. Then we got to some breathing and I could tell that the breathing was just too much for him. I mean, it started to bring up the vasanas and he couldn't tolerate it. And so we stayed in the Anamaya, which was okay. However, then he started telling me about his wife. Now, this is somebody who would never go to therapy, a wonderful person. And he started telling me a little bit about his wife, a little bit about himself. And, you know, I didn't take on the role of the psychotherapist. I was holding the space and listening. Then all of a sudden he could do the breathing. So, you know, it's this subtle play of where, you know, I'm allowing this, you know, and I didn't give any feedback to what he was saying to me. I was just there for him. And so, yes, I would agree with you that that's very much, because I asked him when he came to me, I said, what have you done? Well, I've had injections, you know, steroids, I've had this, I've had that, and nothing worked. Exactly what you're saying.
Good.
So yeah. And this is the beauty of what we offer. This is the gift of what we do offer. If we have the classical training, I think.
Yes.
You know.
And that's why we are very, very lucky in our tradition that we still have the classical tradition. We are not like any other training. We are so unique here and we are so lucky and fortunate about that. Anita, there's lots of wonderful feedback coming. There's one very nice feedback I want to read to you. One of my students from Korea, Cha, she's also a psychotherapist. She says that it's very encouraging interview for me as a counselor and clinical health psychologist in Korea. So she's very happy to hear this. And yeah, so it's very interesting. So Anita, we are slowly running out of time. So I just will shorten it and ask one last question. Since this is about Shri Shakti, the women, how does Viniyoga has resonated with you as a woman? Because woman's body is very different from the man's body and it goes through much more changes. And you've been doing your Viniyoga for the last 18 years. So how has it resonated with you as a woman?
Well, it's seen me through, I mean, one of the things that your mom really helped me with when I first met her, I was going through perimenopause. So the changes in life, it was really beneficial. The practices she gave me for that were remarkable. It's allowed me to have many roles and be, you know, right now I have 4 generations. I have a 94-year-old mother. I have a husband. I have 3 daughters. I have 4 grandchildren. And so they all live up in the San Francisco area. So I go up almost, you know, every 6 weeks and help for a week, come back, work a lot. It's allowed me to have this remarkable life where I have seen my relationships with my daughters improve and with their husbands and partners. and have every aspect, enjoy every aspect of my life. So.
Yeah, it's amazing. Your family now is as big as the British royal family.
No, 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 it's not.
You know, you said your mother is 94. The Queen is 95 today, or yesterday, a couple of days ago, you know?
Yeah, my mom lives 5 minutes from me. So I drop in, and now I can go without a COVID test. And so I drop in and see her a lot. And it is quite remarkable. And there I am taking her pictures of her great grandchildren. So it's good. And I think that Viniyoga has allowed me to do this, to hold all of this with, you know, as much equanimity, and, you know, each year a little bit more sattvic energy, you know.
That's very good to hear. That's very good to hear. Well, question, if possible. One lady, Maria Alejandra Sierra Hernandez, she's from Colombia. She's asking this question. It is about postpartum depression. How do you deal with this? Anita, you're the expert on depression. You should know.
It's not easy. It's not easy. I mean, hello in Colombia. My first 5 years of life were in Cartagena. So Spanish was my...
Maria and her husband are from Colombia, and they're always watching our interviews.
Yeah, my first 5 years of life were there. My father lived there for 20 something years. Postpartum depression, I don't really see that because I work with, you know, I said like in the 40s on up. However, I think very support groups, therapy for these individuals is really important. The possibility of medication short term can also be helpful. And then really the supportive relationship, the relationship that you have with them, to let them know that they're not alone. One of the things I didn't mention was how helpful it is for people who come to me, because I work with people with chronic conditions, and often they feel they're the only one because they're living isolated lives. And then for me to be able to, you know, talk openly and say, oh, I have a lot of students like this. You know, this is not so unusual. I know you're suffering a lot, and it's, you know, and it's such a relief for them. And I think the same thing for postpartum. Your relationship is so important with them.
I think a lot of people with depression, one of the things that happens is they feel that they are alone.
Yeah.
They feel exactly. that they're alone. This is one of the big problems.
Yeah, and to help them understand that, and actually I begin to help them understand that this state of loneliness can be used as a spiritual journey, because really, when we get in touch with the loneliness, we can begin a lot of spiritual progress.
Yeah.
It's quite remarkable.
Yes. Yes. And I think connection to nature, connection to things that are natural is also very helpful in coming out of depression. And also physical touching your family members, friends, animals like dogs. This also is very good for coming.
Yeah, I used to do with the veterans, we used to do a lot of chair kind of asanas where they were touching themselves, you know, this, you know, touching, rubbing their things, they would touch themselves. And that's a way to help people get back into their body also.
Exactly.
So
she's very happy with your response. She says, thank you so much. Sometimes we have pregnant students or new moms. Yeah.
Good.
Yeah. Excellent, Anita. So we will slowly come to the conclusion. Do you have anything last that you want to say or do, you know?
No, just to everybody, how much fun this is. Have fun with the work, because the students are remarkable. Everybody is different, and it's fun.
Yes. So thank you all, friends from around the world who have been so kind to join us today, and in this fascinating interview with a very fascinating woman. Anita, thank you so much.
Thank you, Kausthub.
Today. You are a very, very special woman. You know that. And you're very special to us too. You know that too. So thank you, my dear. And please continue your extraordinary work.
Thank you so much. Thank you.
Thank you. And thank you, friends. And we will see you in another 2 weeks with another.
Best to all of you. Thank you for being here, and the best to all of you.
Namaste.
Bye. Namaste.